So after surgery, once patients wake up, there's two different categories. There's going to be an inpatient surgery and there's going to be an outpatient surgery. The general routine is actually the same for both. It's just whether or not you're doing it in the hospital or not. So whenever you wake up from surgery, certainly there's going to be some pain, there's going to be some side effects from the anesthesia, and the nurses and the care providers are going to help compensate for those. If you're going home, a lot of those medications will be on your bedside. If you're in the hospital, those will be provided by the nurse, and that's the main difference there. It's very important to get up and start moving right away for most surgeries, of course, following any restrictions we gave you. For most joint replacements, really we want you moving 5 to 10 minutes every hour, starting pretty much when you wake up, unless you're sleeping. And if you're sleeping, we want you to sleep comfortably, but we don't want you to be too sedentary, meaning, laying and not doing anything, because typically that actually worsens the pain. Pain medications we give you, there are a lot of them, and there's some instructions that we usually hand out. And you can also reference some of the other videos we've done to go over the details of those medications. But again, we try to get you to start on those right away. That's going to help you stay ahead of the pain. What we really don't want you to do is get behind, because then it's really hard to catch up. Ice in general is your friend. Do 15 to 20 minutes on, 15-20 minutes off, so that way you don't get too much contact between the ice and the skin. But again, it's important to get the ice going. Food, you want to start slow. Add a little bit more food as your stomach tolerates it. If you get nauseous, you got to back off a little bit. Therapy, typically if you're in the hospital, that'll start the same day. If you're home, it usually happens within a couple of days. In the hospital setting, first, you'll go through the process working therapy. Medicine doctors will typically follow you in the hospital to make sure any other issues going on are solved and help towards getting you out of the hospital. Most of my patients with the joint replacement will go home the next day if they decided to do it as an inpatient versus an outpatient. And then once you get home, the process is the same as those who go home straight from the surgery. A lot of my joint patients who have replacements choose to go home the same day of surgery, which is great. Main thing you need to have there is family support, and that's true on both sides. You got to have somebody to drive you home. Once you get home, somebody to help you get in the house. One quick tip is I usually recommend somebody to bring a chair outside if you have a longer walk to the house into the door, so that way if somebody gets uneasy, unsteady, nauseous, they have somewhere to sit. I'd much rather you sit than fall. Once you get into the house, get comfortable. I usually recommend trying to stay on the first floor for the first couple of days to avoid stairs. Rest comfortably, get up for meals, get up to walk, start stretching, and then home therapy will usually get engaged within that first couple of weeks. You're going to have some ups and downs the first couple of weeks, some really good days, you'll have some rough days, that's normal. On the medication front, again, use what works best for you and kind of follow our guides on what follows for those. Once we get to the 2-week point, that's typically whenever I'm going to see somebody in clinic. And we'll do a wound check, we'll go over all the restrictions, make sure we're seeing the progress with therapy. Dressings. Most of my patients will have a waterproof dressing whenever they leave the operating room. We usually still recommend not taking a shower for the first 2 to 3 days, just because everything's still very fresh, and part of it's just the precautions of being in the shower. It's a high risk area to be. But after that, once you take off the dry dressing, meaning like Ace Wrap and anything that's real fluffy or absorbable, and you find the waterproof dressing, which we want to leave intact, that's usually when you can shower. Again, that's not for every patient, but for a majority of patients, that's the case. Dressings, sometimes we'll get reactions to those. If you see a lot of redness around it, if you see something concerning, please let us know right away. Also, things that patients should be looking for, any sign of infection. So fever, pain that's getting worse, not improved with pain medications. If you get swelling, even with your compression hose or with leg squeezers that we'll sometimes give you, doesn't get better with elevation, those are all things to be on the lookout for. And then again, once we see you at 2 weeks in the clinic and we evaluate the wounds, make sure you're progressing well, that's when we'll decide, all right, how much more are we doing at home versus going to outpatient therapy? And I always say, look, it's like moving from JV to varsity. You're going to start stepping up the activity level, get on the machines, things of that nature.